Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm delighted you can be here with me. My first guest is the illustrious Jane Russo.
Thank you.
Jane, you are the assistant administrator at the VNA and Hospice.
That's correct.
Well, this is great because you teach people about the community outreach program. And so that means that I'm going to learn a lot today. This is so great. Now, before we get into sort of the teaching aspect of what VNA can do for us and what the hospice really is about, let's find out a little bit about you, Jane.
Sure.
So how did you get to be assistant administrator for VNA and Hospice?
I actually came to healthcare because of my grandmother and the need to have additional resources for our family.
Oh, well, that's fascinating. So your grandmother had a need for some home health care, or? She
actually had Alzheimer's. And so with dementia and the need for community resources, we reached out to a hospice program.
And so that sparked your interest in healthcare and VNA and hospice?
Absolutely. And the organization has been around here for 62 years, so coming to VNA allowed me to be able to connect with the community and resources.
Well, excellent. Now, you're connected with the VNA and hospice here in Monterey?
Yes.
Great. Now, was this your first position in VNA and hospice care? Or?
Oh, no. I've been in healthcare for the last 15 years.
Well, tell us how you got into, tell us like, did you go to school for this? Did you train? Just something that
No, ironically, I went to school for marketing and hotel management. But because of this experience with my grandmother, it allowed me to work into the healthcare and resources. And so once I became involved with our nursing care, I realized, so I've been with VNA for the last 2 years. But prior to that, I traveled regionally and supported home care and hospice agencies.
Perfect. Okay. Well, Jane, I really very much appreciate you coming on the program.
Thank you.
I think this is a very important topic. You know, as kind of an introduction or segue, you know, we're hearing more and more about keeping people out of the hospital, right? And
exactly.
I have a lot of patients who say they just want to get their care at home.
Right.
Why do they have to stay in the hospital? Can't they get IV antibiotics as an outpatient? Can't they get their medicines at home? Can't they have a nurse come to the home?
Right.
And they actually do not want to be hospitalized. And there, of course, there are other reasons why we may want to administer health care at home. So with that question as an introduction, tell us about the VNA. What purpose, Visiting Nurse Association, what purpose does the Visiting Nursing Association serve?
Sure. So VNA and hospice has really 4 components. Our first and main group is our home care agency and the home care side. We also have community services, which is the face of VNA, if you will, the white coats that provide our flu clinics and our outreach to the community itself, our hospice program, and our adult day center.
Okay, so those are 4 aspects, and let's go over that again. So the home care, community service, the hospice,
yes,
and then the 4th is
the adult day center. So it's a physical location that's on Cass Street that allows patients that have like Alzheimer's or dementia or mental capacities that need that day center for them to go to. So it's a location that folks can go to down on Cass Street Monday through Friday, give the family members a break and a respite. So the home health is really the core. Home health care is, like you say, the most people want to be at home in their own environment, staying out of the hospital. Home health care allows for people to bridge to their home and receive that ability for rehabilitation and physical therapy, nursing care brought to them in their environment that they're comfortable with.
Well, perfect. Well, Jane, I can provide a couple examples as a plastic surgeon.
Yep.
Let's say I take care of a woman who has breast cancer. She had a mastectomy. She undergoes breast reconstruction, but she doesn't need to be in the hospital past, say, 1 or 2 days. But she still needs nursing attention.
Correct.
So she may need drain care and wound care and vitals taken and assistance with her medications. So tell us more about the mechanics of how that works.
So we coordinate initially with you as her physician, as well as family members and the hospital as she's coming home, just to learn about the type of surgery she's had, what's going on. We arrange equipment to be in the home, an oversight of what nursing care would look like. And then once she gets home, our nurses would make, we have typically a case manager that would make visits, set at work with the IV company, Access IV, set up her medications, and then teach and train on what that would look like to make visits to her. The nurse may visit a couple times a week. If you felt physical therapy or occupational therapy, depending on hindrance in the arm and whatnot, would come to the home and provide that care in that environment.
So it sounds to me like a lot of the services or treatments that we typically administer in the hospital, for example, wound care, physical therapy, IV antibiotics, those can be administered or given to a patient at their house in certain cases.
Absolutely.
So maybe we can go through those. So you have a nurse, a registered nurse, who has special training in home health, can go to a patient's home and hang an IV, right?
Exactly, yes.
And give them IV antibiotics, et cetera. So what about wound care, physical therapy, other medications, say vital signs checks, all that stuff?
Yeah, so our nurses are, we have wound care certified nurses. So even if, teaching a patient and a family member how to change the wounds, providing the supplies, the bandages. I mean, of course, for you and I, it seems it's normal, but for someone that has an IV, for example, that's very frightening. So teaching someone what that looks like, what signs to watch for when the medication finishes, providing that peace of mind and comfort in the home. The physical therapist would train and teach new habits, if you will, maybe not necessarily on the example that you're providing, but if you have a new recent knee surgery, to go home into someone that's homebound and can't leave their home, the therapist would come to them and teach them exercises within that environment, bringing tools and training.
Perfect.
There.
Okay, so it sounds like it's almost like a little mini or micro hospital that's mobile, and we can bring these services right into a patient's home.
Definitely. Home health care is probably one of the is an underutilized benefit for Medicare recipients as well. It allows them the comfort to stay in their home, and it's covered by Medicare and allows peace of mind.
Okay, so Jane, great segue.
Thank you.
So VNA services do not necessarily have to be covered by a patient's own, I mean, they don't have to pay for it themselves. It can actually be covered by Medicare. What about certain private insurance?
We do. We contract with a number of private insurance companies, and it typically mirrors we're Medicare certified, so it would mirror the Medicare benefit. Medicare, some Medi-Cal as well, allows to have these services in the home.
Okay, perfect. Now, is there a limit to, say, a nurse can visit them at their house for 2 days or 2 months or 2 years? I mean, is there a limit to insurance or Medicare covering that service?
Yeah, home health care is really about the episode, if you will. As you described the example, it's really about that particular incident, that's medical care that's going on. So once you've taught the patient or completed an IV medication or we've met the goal of rehabilitation, then it ends. So it is short-term. Home health care is short-term rehabilitation. As we'll move on to hospice, there's less stringence, but Medicare home care is very incident-based or medically necessary.
Okay, so in summary, if someone has an operation and they're taking care of, they're getting their care in the hospital for 1 or 2 nights, 1 or 2 days, then they go home and they're not totally ready to be independent yet, it sounds like that's the time for the VNA to come in and assist with sort of a hospital extension at home.
Yes.
They can get IV antibiotics, pain medicines, physical therapy, wound care, etc. So what about the person, let's say someone has a heart attack or a stroke and they get through the acute period of being ill, but it seems like they're going to need many months of assistance or follow-up, and the family feels overwhelmed. So how can we help that person?
Typically in those cases, while they're under our home care, we also have a discipline called medical social workers, and we would assist in reaching out to public health, for example, or helping them hire home health care, private home health agencies or staff to be in their home, looking at resources, maybe for long-term planning, what that would look like for a family and a patient for longer stints. We can do another certification on home health care in some cases, but those, sort of reaching out to the community is what we would use and to assist the family and patient.
Well, great. Jane, it seems to me that there's a movement not only to save money, but to allow people the sort of comfort and convenience of being at home, that the visiting nurse service is really a growing aspect of medical care, don't you think?
Yes, we hope it is, and we hope, we've been serving the community for so long, and we continue. That goal is, being the leader in transitional care.
Perfect. Well, Jane, let's talk a little bit about community service. Mm-hmm. So apart from the home care services, tell me about community service and the VNA. So
our community service group is really the flu vaccination, travel health. So if you're planning a trip, for example, a couple weeks out, to come into our office and can be evaluated on appropriate vaccinations for travel, flu and overall health. A big component of our community service is our Wellness at Work program, and it allows us to partner with companies in providing better employee satisfaction with our nurses, assessments and wellness through their employer. Let's see, flu vaccine. I think that, yeah. So those are really the core.
Perfect. So it sounds like those are very valuable services that you can offer through the VNA. Mm-hmm. And as well, are those covered by insurance? Do you know?
They are, yes. Okay. So most of the vaccinations are covered by Part A or Part B. It just depends on. And then, of course, the Wellness at Work is a partnership with employees.
Okay, perfect. Well, let's move on to hospice care. Jane, mm-hmm. The hospice, I'm also familiar with the hospice, but primarily for my patients who need some more technical assistance and more intensive nursing, so they're not quite ready to go home, mm-hmm. but they don't need sort of the intensive care that you can get in the hospital. Right. So for a lot of my patients, breast reconstruction, et cetera, or some bad injuries, it's kind of a transitional care place where they can get extra physical therapy, nursing attention, medications, pain medicine, et cetera, et cetera. They don't quite need the hospital, and mm-hmm. they're not ready to go home. Mm-hmm. But I think that there is more than one aspect to the hospice, isn't there?
Yes. So hospice is actually it's not a place; it's a philosophy of care. Hospice is more it's about care for a patient that has advanced illness or and is looking for comfort and overall well-being.
So I like that. So it's not a place; mm-hmm. it's a thought process. Did you say it's a?
I say philosophy of care.
It's a philosophy of care for mm-hmm. someone who needs extra services and attention that they can't get at home.
Correct.
And that may be not appropriate at the hospital.
Mm-hmm. Mm-hmm.
So
can be in a facility, a skilled facility, or an assisted living or a board and care.
Okay. So let's say a family, a patient is confused about all their options. Mm-hmm. And of course they're dealing with a recovery or a physical ailment. Mm-hmm. They had an episode of severe illness, and they're confused about all the options. So what do they do? What do they do?
They call VNA and hospice.
Okay.
Yeah, and then, it's really working through our core components, but hospice is really defined as 6 months, or if a patient has 6 months or less to live if the disease continues its normal course. But there is palliative care, and a lot of patients fall under that not quite ready, or more confused about what their goals and wishes are, or maybe a new diagnosis. Palliative care is the same. It's a same thing, philosophy of care, but it allows patients to continue treatment. Our palliative care is under our home health umbrella, so it allows patients to receive their treatment while still getting the core hospice team members, if you will, a medical social workers, grief support, spiritual care support, allowing patients to really understand where they are in their disease process and still receiving medical care.
Okay. Well, Jane, you know, for some people, this is a topic that's difficult to discuss, palliative care. Maybe we can define what we mean by palliative care, and talk a little bit about why it's difficult for some people to discuss it or make plans.
Sure. The word itself is oftentimes in healthcare, or to any of us, is confusing. It really means comfort care. It means that a patient is still wanting their overall goal. They don't have to have an advanced illness or a terminal illness, but their overall goal is to seek comfort for their care. So not necessarily receiving constant aggressive treatments, but they still may want to see that, you know, of course, want to be involved in their physician, or have, you know, if pain or issues got out of control, they may want to have a hospital stay. But most of those patients really want to have conversations around their goals and their wishes, their advanced directives, getting those in place, or like you say, it is scary and they're not quite ready. So it's just time to support. Pulling family members together. A lot of patients, you know, under the palliative care role, if you will, need the family members to be on the same page, or mom might need some assistance, understanding dad's diagnosis, for example.
Well, that's fascinating. I think it's a huge and growing topic of interest, of course, because we have the number of elderly, just the sheer numbers is really swelling, and more people want to take control over their own medical decisions and their own medical care. So I think it's fascinating. You know, Jane, unfortunately, we only have about a minute left. Can we touch briefly on the adult daycare services you offer, and then if we can give out some contact information to see if people have more questions about VNA and hospice, how they get more information. So before we get on to that, so tell us briefly, in summary, what is the adult daycare services that are offered through VNA? So
the adult day is a center that's located on Cass Street. It allows patients and families to have a break, so it's really a respite, if you will. It's a adult day. It's a day center where patients with Alzheimer's, dementia, mental incapacities can go Monday through Friday from 9 to 3. That's a program that they're enrolled in. They have great hot lunches, so it allows that break for family members and allows people to be in a safe environment for interaction with our care staff.
Well, Jane, you know, my producers have Mary Lou and Jim, of course. They've heard me say this before, that when I have segments, when I learn a lot myself, I think those are my favorite. And you've taught me a lot in the past 18 minutes. I think it's terrific.
Thank you.
I'd be delighted if you come on the program again.
Oh, thank you.
And now I want to pay you a compliment. You know that Jane Russo came, and she only got a few minutes notice. She's covering for a colleague. I think you did great.
Oh,
thanks for teaching me, and thanks for teaching the audience.
Well, thank you for having VNA and hospice. You know, we appreciate being part of this community.
I am delighted. Jane Russo. Now, before we transition, is there a number, website? How do people get more information? Sure.
Simple enough. Our number is 831-375-9882. Or our website is ccvna.com, Central Coast Visiting Nurse Association.com.
Well, wonderful. Jane Russo, 831-375-9882, or ccvna.com to find out more information about VNA and hospice.
Thanks
so very much for coming on the program. I appreciate your teaching.
Thank you.
Once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. We're going to take a very brief pause for a very good cause.
We'll be right back with more of the Your Health television program here on AMP's Cable Channel 24 and on the internet at ampmedia.org.